Devin.
Hi.
I'll be your nurse doing your assessment today.
Okay.
Just going to be looking at your head, your ears, your eyes, your nose, your mouth, and then down in your neck today. So let's go ahead and get started. Right now I'm just kind of observing your overall appearance, your hygiene, your mood, your effect. Everything looks good, looks normal. I'm not noticing any problems with hearing or speech so far, so that's good. You have any I don't observe any problems with your nutrition. Do you feel like you have any nutritional concerns?
Nope.
All right, so I'm also, when I'm talking to you now, I'm looking at your eye contact, seeing that you're alert, you're oriented, and all of that looks normal. So now I'm just going to go ahead and start. I'm going to feel your head, feeling for any lumps, masses, anything like that. Do you have any pain?
Mm-mm.
Looking at the hair also to just observe your nutritional status, your hygiene, like I said. Then I look at the face, see if it's symmetrical, see if everything looks the same on both sides, and it does, so that's good. I'm just going to feel your temporal arteries right here. And I'm going to move on down and feel your TMJ. Go ahead and open your mouth for me and close one more time. And then now I'm just going to feel your sinuses, your maxillary, and your frontal. Good. Now I'm going to go ahead and move on to your eyes. So first thing I'm going to do is check your peripheral vision with the confrontation test.
Okay.
So just tell me when you can see my hands.
Yep.
Okay. And again.
Yep.
And one more time.
Yep.
Good. All right, now I'm going to go ahead. I'm going to get out my light, and I'm going to look in your eyes and ears and nose with it. So just go ahead and look straight ahead at me.
Okay.
And you'll just go ahead and follow my finger. Good, and then just keep looking straight ahead at me, and I'm going to pull my finger in. Good. All right. Now if you can go ahead and cover one of your eyes for me, just look straight ahead at my nose, and you can uncover. Okay, and then the other one. Okay, good. I'm going to shine this light in your eyes again. I'm just looking at your sclera, your conjunctiva, your cornea, your iris, all of that. I don't see any redness or discharge or swelling. Do you have any pain?
Mm-mm.
Everything looks good there. Another thing that I look for with the light is your pupil size. Checking to see if pearl is present, and it is. If I were doing a field vision test, I would use the Snellen chart. That's where you have the letters hanging on the wall. You would cover one eye, and I would ask you to read a line, and we would cover the other one, and then we could read without both being covered, but we're not going to do that today. So next I'm going to move on to your ears. So the first thing I'm going to do is I'm just going to observe the outer ear, look for any lesions, any deformities. I don't see any. Just going to feel The ears, they feel fine, nice and soft. Do you feel any pain?
No.
Okay. So I'm gonna go ahead and look at your inside now. Check your tympanic membrane and your ear canal. So if you'll just go ahead and turn your head for me. Pulling up and back on the ear. Looking for any redness, any irritation, and I don't see any. Looks good too. Now I'm going to perform a whisper test. So what I'm going to have you do is I'm just going to have you occlude one of your ears, and I'm going to whisper a word, and you just repeat what I say, okay? So go ahead.
Apple.
Okay. And again on this side.
Baseball.
Good. Alright. Okay, now moving on to your nose. Right now I'm just looking, making sure it's symmetrical in the center of your face. It's midline, it is. Look, make sure both of your nostrils are, see that there's patency. Okay, good, there is. Looking for any lesions, drainage. I don't see any. I'm gonna look for, when I shine my light in there, I'm gonna look for your septum, look at your mucosa and your turbinates. Pink and moist. Your septum is midline, no deviation. Looks good. You having any pain in your nose? Okay. Good. Now I'm gonna look in your mouth, so I'm just gonna be observing your mucosa, your teeth, your gums, your palate, the floor of your mouth, your tongue, your uvula, and your tonsils, all of that. So go ahead and open up for me. Look at the floor, the teeth, your gums. Look at your soft palate. Okay, if you could stick your tongue out for me. Say ah.
Ah.
Looking at the uvula, it's midline. Looking at the tonsils. Good. Okay. And then all I have left to do is just observe your neck. So first I'm just going to look at it, inspect it for, make sure it's symmetrical, like once again, and then I'm going to feel for masses, lumps, anything like that, and then I'm going to feel your lymph nodes, and then observe your trachea and feel your thyroid also, and then we'll be done. So it looks nice and symmetrical. I don't see any lumps, but I'm going to go ahead and feel. I don't feel any lumps or masses. Do you have any pain? Don't feel any tightness. I'm going to start by feeling your lymph nodes. I'll start in front of your ear, work my way behind your ear, and then down your neck, okay? Feeling any tenderness? Go ahead and turn your head to one side for me. Okay, and the other. Good. I'm just going to feel your carotid pulse. Feel on this side. Good. I'm just going to feel your trachea. Once again, make sure there's no trachea deviation. Make sure it's straight, midline. It is. Go ahead and swallow for me. Okay. Feeling your thyroid, make sure it's not enlarged. Okay. And then the last thing I'm going to do is just check the range of motion in your neck. So if, just like you did with your eyes, if you'll just this time turn your head with my finger. Good. Did you have any pain doing any of that?
Nope.
Okay. Well, then that concludes our examination for the day.
All right, thank
Thank
you.
you.